welcome back everybody, and Dr. Willa is with me, so we are going to be speaking on the topic of COVID-19, and today, as Rokas mentioned earlier, is Vaccination Day, and it's a lot to look forward to, and there are some other things we're going to be speaking about with regard to COVID-19, some of which may be quite worrying as well, but we have Dr. Willa here, who is the WHO PAHO representative for Trinidad and Tobago, as well as the Dutch Kingdom Islands. Good morning and welcome, Dr. Willa.
Good morning. Always happy to be here.
Always happy to have you here.
Thank you.
Dr. Willa is like our go-to when it comes
Exactly.
to COVID-19
Yeah,
and
of
how we're
course.
doing. So are you excited about today, Dr. Willa?
Yes, very much so. You know, we've been anticipating this for some time, and finally we are here. We only got the vaccines last Tuesday, and today we're
Already ready to, and everything seems to be green-lighted and go and good to go?
Yes, because there's been a lot of planning behind the scenes for many months now on the rollout of the vaccines, planning based on international guidelines, WHO guidelines of the different steps that we should follow. And again, you know, nothing is perfect. We may have little hitches, but I think the government is ready to start rolling out the vaccine.
Now, Dr. Willa, for the past few days, maybe a week or so, I have been personally a little bit nervous because, not because of the vaccines, but because of the rise and the spikes in the numbers.
Yes.
We saw that the rolling day average went from being 2, 3, 6 to being something like 27. The rolling day average,
Yes.
according to the minister,
Yes.
and it's like that's an 8 times increase. Like, how do we get there? How do we stop that from? I don't even know where to go from there.
But remember, we did have a similar issue last year,
Yeah.
right, where the numbers were going up. And what did the government do?
Shut down.
They had to put in restrictions. Now, in the world, we have a better idea of, you know, targeting which particular areas or activities are most likely to cause spikes. So the way to go would be to zero in on those areas and reduce the numbers of people, because it is the numbers of people in close proximity that causes the transmission, which we've always known, like the flu, but it's more transmissible. So we have to be, I should say the government needs to be very astute in choosing the places that are causing the spike and then taking steps to actually address it. And we must remember, we still have to do the social health and public
That's
health
the thing.
measures.
That's the
We
thing.
cannot get away from that, because internationally we see whenever there is a spike and persons actually follow the public health and social measures, the numbers drop. And when we stop doing it, the numbers go back up again.
That's right. In a recent article, I read that the UK variant was found on with an individual on a vessel.
Yes.
Could you tell us a little more about that and how the government is dealing with it?
Well, I know, excuse me, I know, for example, that when persons coming from the UK are identified, that the government usually isolates that individual. They don't let them mix with the population.
Right.
Because, of course, if you let anyone with the UK variant mix with the population, then, of course, what's going to happen is not just a spike, an explosion.
Party done.
Cases
Yeah.
will happen. So the issue is to isolate that individual and treat them, and if they need to be hospitalized, but they weren't in this case, as far as I'm aware. But you need to keep them away from others so that they don't transmit to one or two or more others, because with the UK variant, it may not just be one or two people, it might very well be more. We don't have the science that says the exact number of people who it can be transmitted to, but we know that the isolating the individual and observing them and treating them if necessary is the way to go.
Of course, and you know, taking the steps and precautions that we have been hearing for, you know, since the beginning of the pandemic and our first case here in Trinidad and Tobago. We are now 1 year in, or well, a little more, and we have seen, you know, a spike in the numbers again, and we've seen these things. But again, please remind the public of some of the things that we need to be doing with regard to that, because some people apparently need a reminder, Doctor.
Yes. Well, just to say before I give the reminder that I was doing a bit of reading and I realized this is an international problem or challenge, that persons do become complacent they do stop observing the public health and social measures simply because they seem to be so easy to do that,
Right.
you know, normally you have to take a pill
Yeah.
or get an injection or a vaccine.
Right.
But telling someone to cover their mouth and nose and not wear their mask below their nose or not wear their mask on their chin seems to be very challenging, because as human beings we feel we must be free to speak and move about
Right.
and so on. But that's what the virus loves. It loves when people congregate. It loves when we are in a position where we are close to each other and we talk to each other and we don't observe those measures. So many studies have been done in Europe and the USA, and there are now questionnaires about behaviors, what is driving, you know, the behaviors, and why can't we stop it. So what we need to do again is ensure that we keep our distance, okay? 3 to 6 feet. WHO says 3 feet. CDC says 6 feet. Here we observe 6 feet. Wear your mask properly. Don't touch the front of your mask. Keep it, you know, you have to adjust it from around your ears. Sneeze into the crook of your hands, or if you need a tissue, throw the tissue away. Do not, if you're feeling ill, don't go to work. If you have symptoms of, even if you think it's just a cold, don't go to work. So we need to continue masking up, sneezing and coughing in our tissue, our hands, and please, please do not congregate in large numbers, because that is why we have variants.
Right.
Exactly that, because when too many people congregate, it gives the virus the opportunity to change and adjust itself,
Right.
which
And
all
to
viruses
mutate.
do anyway,
Right.
and it mutates, and then we end up with B117, the UK variant, the Brazil variant, the South African variant. So it is a plea to the public, please, please continue to wear your mask, social distance, sneeze into the crook of your hands, and observe all of the public health measures we've continually been trying to tell people to observe.
Over here now. Back to the vaccine now. When it comes to the vaccination rollout process, who are the who is the priority given to in this first instance? Because we know that we don't have enough vaccines for the country,
Yes.
for the entire country. We know that as a
Yes,
fact.
yes.
Who is going to be the first batch of individuals that are given priority to receive the vaccine?
Okay, so in phase 1, it is persons who are frontline health workers. As you would know, they're the most vulnerable, because
Right.
the international criteria is that you give it to persons who are most exposed, who are most vulnerable. So frontline health workers, you know, doctors, nurses. Also the persons over 60 with underlying health conditions.
Right.
And why? Because these are the persons, if you look at the figures and you listen to what the press conferences say, these are the ones who are most vulnerable: elderly with underlying health conditions, or older persons with underlying health conditions, diabetes, hypertension, people who have respiratory problems,
Right.
heart problems. So they will be the first groups, those two, after which you would have persons over 60. So this is the way we are going, and the government has, I believe, put out information to this effect. So if you don't fall into those first groups, don't expect to get your vaccine right
Today.
away.
Right.
Not today.
Not
Yeah.
today in the first, the 33,600. Don't expect to get your vaccine right away. But the government also has figures on who these persons are, both those in clinic, well, the ones who don't come to a clinic, for example, they have to make appointments. I mean, the clinic persons have appointments
Right.
anyway. So the rule is right now, persons over 60 with underlying health conditions, health workers, and then after we have persons over 60.
All right.
All right. Dr. Willa, I've been looking at the numbers again. I just keep coming back to the numbers.
Yes.
And I see that, I mean, yes, we see the numbers rising and all that stuff, but I see that the numbers of people that we've been testing, they've been average, I would say about 200 people get tested every time we see a new, report from the Ministry of Health. Do you think we've tested enough people? We have tested about just over 100,000 people have been tested for COVID. Is that enough in our population of 1.3 million?
Well, we have to take into consideration the fact that tests in any case are limited. And when persons come in, they have to show flu-like symptoms. it's not just everybody you can test. We don't have the luxury of having so many tests because the PCR tests, that's the gold standard of tests, right? So every country has a certain number of tests to use, and there are criteria that the CMO has laid down for who should be tested. So everyone who shows any influenza type illness or any of the typical symptoms, they will definitely be tested. We are in a situation, I know the ministry has got antigen rapid tests. We've been working with them to validate them before they can be used on the population. And there are quite a lot of those tests, over 100,000. So we know those will be rolled out soon. We have been working quite closely. And those tests, they give results, unlike the PCR test, which could take up to 48 hours, they give results in one type of test in 15 minutes and the other in 30 minutes. So this can change things significantly because then we will have a greater capacity to test going forward because until we get herd immunity, we will expect that there will always be some waves, some spikes in
and that's what I wanted to ask about. Do you think this is going to be here forever? Like this COVID-19 is here to stay?
Well,
like
you
influenza?
know, the thing is, we really do not know. We don't know if, like SARS-1, it will be here and then go away, or if it will come back every year, or if it will come back every 6 months. It's an unknown. We can't speculate at this point because the science is not there, because we simply haven't had COVID around long enough to know whether it will be a once-a-year thing like the flu or not. We just really don't know.
I think we could afford this once a year, no?
I know, but we just have to keep being vigilant until you know we have the signs. So by next year, we will know more about COVID-19 going forward.
Now, there are certain diseases which the world has been able to pretty much eradicate. Now, I know for a pandemic is a lot different because of how widespread it is. Do you think certain measures can be taken in a similar fashion? Let's say, for instance, for the most part, polio, for instance, was something that was pretty much eradicated. We do see some maybe like extremely small numbers in different places in the world, but when it comes to developed countries especially, you don't see polio happening anymore at all. Do you think certain lessons can be taken from the approach toward something like COVID-19 that is even more widespread?
Well, I think in the future, first of all, I think there will be many more vaccines to come. So that would make a difference when we see what they call the efficacy in clinical trials, but what is actually the effectiveness on the ground. We see with Pfizer in clinical trials, it's 97.5. And when it's when people actually have the vaccine, it's about 90% effective. So we have to see over time, you know, as vaccines are developed, how effective they are, and in combination with the public health and social measures. Because in parts of Asia, like Japan, every flu season, everyone wears a mask. We may need to become mask wearers every flu season, in addition to getting our booster shots. And as vaccines become more effective and they are tested to become more clinically effective to different variants, because remember, that's another issue. So as we have less in the population and we have vaccines that are more effective over time, we may, if we continue to have COVID-19, we could get it more under control. But we have to learn to live with it and to take all the steps that we have it in our hands, as I keep saying. We can do it. The power is with us, with the public health and social measures. So we can be optimistic, but I think we have to be cautiously optimistic because we don't know enough as yet.
What the future holds. But Dr. Willa, just clarify for anybody who's still wondering outside, what is the purpose of the vaccine? Like, is it meant to say, well, okay, I take this vaccine, I can't get COVID? Is it meant to be, I won't get sick if I get COVID?
Okay, so first of all, a vaccine is not a cure. Okay? The vaccine is meant to prevent you from becoming seriously ill and to prevent you from dying. You hear the percentages of effectiveness, whether it be 95 or 87. It means that there is still a chance that you may get the disease, but in terms of dying, it is much, much less. But we also see that there are certain groups of people who can't take the vaccine, okay? And those people, when you have herd immunity, they will be protected by the fact that others have taken it.
Right.
So the purpose of having a vaccine is to prevent you from becoming ill and hospitalized, because being hospitalized is critical. It puts a huge burden on the health system.
Right.
And, of course, to prevent you from dying from the disease. But no vaccine is 100% effective on every single human being.
Right.
But we see how effective vaccines have been
over the
for
years.
decades.
Yeah.
So we should trust the science, you know. And if we trust the science and stop thinking, well, oh, this vaccine is 80-something% effective, so I won't take it, and this one is 97%. The fact is, it is to stop you from being seriously ill and being hospitalized and to prevent you from dying.
And that's the most
I feel
important
like
point.
That's the message right there. That's the message right there. So thank you so much for joining us this morning, Dr.
You're
Willa.
most welcome.
Thank you for sharing this information with us and with the public. And guys, today is Vaccine Day. The rollout has begun from today. So if you know you qualify, if you have your appointment set up already, make sure you're on time. Make sure you work with your cards so that everybody will be in the know.
Yes.
Yes?
That's right.
So again, thank you so much, Dr. Willa, for
Thank you.
joining us this morning. Dr. Willa is the representative for PAHO and WHO for Trinidad and Tobago and the Dutch Kingdom Islands. We'll be right back with so much more inside the Now Morning Show. Stay tuned.